But it's a daunting task. You need to answer the question, does type of surgical technique influence outcome of treatment of peri-implantitis? And a number of you encouraged me during the brace that I need answers, and I can give you the answer to that. So only diamonds are forever, and I don't think the implants can last forever unless they're properly placed and treated afterwards or maintained. And if you read the literature, you can find a number of case report series, case series and combined RCTs on treatment of peri-implantitis, but the field is relatively new, so there's not that many papers in this field. And to make the things more confusing, there's a wide variations of materials and procedures, so it's very difficult to judge what is effective and what is less effective, and what combination is the right one. There is no comparable RCTs, and even more so, there's not even consensus on threshold for disease and health. There's not even consensus what is disease. And even more confusing is that if you have a recurrence after 12 months, the question is that a new disease or if it's an old disease. So what we need to do first is we need to give you a definition of the disease. And that is presence of bleeding and probing and pus, bone loss and continuous bone loss, and probing pocket depth of more than 5 millimeters. Now, not a single feature, no bleeding and probing, no bone loss, no individual probing pocket depth can classify the disease as peri-implantitis. You need to have a combination of symptoms and signs. Now, sometimes you can see some swelling on the soft tissues. Sometimes you can see a huge craters around the implants, but pain is not usually associated with peri-implantitis.